In Health Watch, the CDC estimates 1 in 7 adults have chronic kidney disease. Here in Virginia, there are currently over 2,300 people on the state's wait list for a kidney transplant. Yet, the nearest transplant center is at least a 2-hour drive away. Carilion is working to change that and is hoping to open a center here in Roanoke. I spoke to a local patient about what a life-changing difference having those services at home would make.
This is where I do my human oil change.
This is Joey Shervey. And you do this 3 times a day?
Yes, ma'am. I used to do it 4 times. 4 times every 4 hours, but now it's 3 times every 6 hours.
He's showing me his at-home dialysis treatment he needs to live. So 1 bag, is that 1 treatment?
1 bag is 1 treatment.
These bags and boxes of saline and medical supplies go with him everywhere.
It goes into my body and it'll absorb toxins and it will act as my kidney.
With no warning or family history, he was diagnosed with stage 5 renal failure 2 years ago.
It honestly was a shock. It's halting your entire life, especially for us being so young. I'm 28 now, so I was 26 years old then, just starting to climb my life and get ready to support my future wife at the time.
That had to be so scary.
Very scary. When he gave me the call, I was like, well, what is this going to entail? What are the steps that we're going to take to try and beat this?
Those steps turned into miles and miles, constantly driving a 4-hour round trip to UVA. Joey needed a new kidney. UVA is the closest option.
A lot of 2-hour trips there and back.
While you're waiting on the deceased donor, if you were to get that call, you're expected to get there pretty much right away.
Miraculously, he found a living donor. I'm wearing a mask here because at the time of our interview, he was just days away from receiving his transplant.
It will allow me to go from 20% lifestyle back to about 90%.
Thankfully, the surgery was a success and Joey is doing well. But those long drives to UVA aren't over.
For me, being so young, I would need multiple transplants in my life. This isn't a permanent thing.
While he is happy with his care at UVA, the drive times are too much.
It's incredibly exhausting.
Joey wants to get back to work. These newlyweds want to begin their life. While they've accepted doctor's visits will be part of that, they want treatment closer to home, cutting long drive times and hotel stays out of their wellness plan.
If anyone could have it closer to their home, to their support system, their place of strength, it would take off so much weight off of their mind.
That could become a reality. Carilion Clinic has filed a Certificate of Public Need application to bring kidney transplant services to Southwest Virginia at their flagship hospital at Roanoke Memorial. How beneficial or life-changing would this be to be able to have these services here at Carilion?
It would be absolutely amazing.
For the people in charge of saying yes or no to making this happen, what would you say to them?
I definitely think it's a yes. There's thousands of people in just our area with kidney failure. And, not just for us, but for those people as well. I mean, they need it. They need that support. They need that program here. And I think it would be beneficial for so many people in our region.